was in 2022, I guess, when me, Aditya, Divya, we got together and we kind of took this decision to help our juniors, our fellow pediatricians, in getting to a position where they'll not only be better clinicians but also better at giving your entrance exam.
Doc, there are multiple ways to test yourself, the QBank. So there's the proper QBank, there is the elite test, there are the mini test, the grand test. You have to choose one. Which was the best? Which will you choose?
Grand test.
Grand test.
Grand test.
Grand test.
DocTutorials grad test is like they put like every 1 week or so. I felt it very useful. The recall videos are much better in DocTutorials.
Okay.
The QBank especially, because we had a lot of questions in this NEET SS.
What was your MCQ strategy?
So every day 3 hours. So I solved like 50 to 60, probably 100 even.
We have our juniors who cracked exams with, flying colors. Shobia and Disha we have with us. And, we wanted to speak about their journey specifically because it's not always easy through our mid to late 20s especially, because we're still in our student life through our MBBS when we're giving our PG, but giving a DM entrance has its own struggles. So firstly, can you introduce yourself?
Hello, thank you for the opportunity. It feels good to be here and talking to you, to people who have already succeeded in this particular fields and guiding us. It feels good. So I am from Bangalore. I did my MBBS from Bangalore Medical College and I passed out in 2020. Then in 2021, I joined MD Pediatrics from PGI Chandigarh and I graduated in 2023 December. Then after graduating, I was a bit confused whether I wanted to do a super specialty I wanted to do, and what is my patient base when I go back to my place. So I thought I'll do 1 year general SRship and then see from the place where I come from what is the need, which subject is the most in demand and which will be suitable for me as a physician. So then I decided by around 4 or 5 months of my SRship, then I thought I should definitely do this DM, and I had a particular inclination towards neurology, and then I started preparing seriously from there.
Shobia?
I finished actually my undergrad in 2018. I passed out from Stanley Medical College and I did my post-graduation in Madras Medical College, and I joined in 2019 and I passed out in 2022. So MD Peds was decided because when I did my undergrad, I knew this is what I wanted. I had a doubt between general medicine and Peds, but I thought this will be more satisfying. So personally, I felt Peds was my favorite, so I took Peds. Back then I was like decided only general Peds. After that, no more super specialty. I was decided that I will not do anything more than MD Pediatrics. So then I took my and also I was decided on Madras Medical College. I don't know why. I just went to MMC once and I felt this is where I should do. This is where I should do. That's all. So and then while doing my postgrad, I felt my favorite was general Peds only, not anything. I think probably because we have a direct connection with patients in general Peds and the huge caseload there. I liked only general Peds. And but when I finished, I thought 10 years I'll do only general Peds. Only after that I'll decide on specialty. Until then, let me do general Peds because I felt only that was satisfying for me. Neonatology I didn't like much during my postgraduate period. So when I finished and I came and joined work, I think my idea totally changed because what I saw in MMC was not seen outside. All I saw was fever and the same thing, and it was really, I felt what we see in tertiary healthcare is not
valid for secondary and
secondary. It is not valid. So we think we study all that and we want to keep applying that every day, but that doesn't work out in in the place that we plan to settle. So when I worked in Coimbatore, I thought, okay, I'll do some specialty. Yet I was not decided on what I wanted. Then I worked 1 more year in Tanjavur. So there when I went and worked, rural place, so there was no neonatologist. So that this place needs a neonatologist. So general pediatricians managing newborn babies, even 28 weekers. So that's when I thought, okay, this place needs a neonatologist. I was not sure whether I'm going to settle there, but I knew there are places where there is a need for neonatology. So then that's when I think I liked I thought it will be more satisfying. So by the time I wanted to study super specialty, it was already, I think, 2 years from finishing my postgrad. Then I decided, okay, I'll do neonatology. So this last year, I actually gave my exams last 2 years, but then I didn't prepare. This time I prepared and I took.
with flying colors.
Yeah.
Yeah. So I think she very valid what you said, that that when we joined pediatrics, in fact even when I joined pediatrics or when Vishnu joined pediatrics, we there is always this thing in our mind that maybe DM is not necessary.
Yeah.
While that is partially true, I'm not going to say that is it is incorrect. What she rightly pointed out, that a lot of us, when we practice pediatrics in a tertiary care center, the expectation and the kind of patient repertoire we see in a tertiary care center and the academic high that we get in a tertiary care center might not be valid when we practice general pediatrics in a secondary or a primary health center, or where we want to settle for that matter. And maybe if we want to settle in a particular place or in a particular area, that particular place might have some general pediatricians already, but I will actually require some subspecialty and a super specialty care. So like Disha said, that you felt that there is a need for neurologists, pediatric neurologists there, and you felt that there is a need for neonatologists there. So yes, general everyone loves pediatrics. Like we all love kids and we all love taking care of them. But maybe simply from the perspective of where we want to settle and where we want to grow both academically and professionally, we might need to do it's a better thing to do a DM or do a subspecialty, because it helps you grow better both academically and professionally. Sure, definitely do an SRship. I would actually advise everyone to do an SRship. It helps you get in both of your cases, it helps you get a clearer idea as far as what subspecialty would be best suited for you guys. One thing I want to put to both of you, frankly, how would you feel is the SS preparation different from PG preparing? There's only a 3-year gap. You gave an exam at let's say 22, 23 years of age, and now you're giving another exam at 26, 27 years of age. But I personally feel there is a dramatic shift in approach, obviously, and in our own mental and physical capacity to give the exam.
Stage of life.
Yeah, the stage of life where we get married, we might have a kid and anything like that, or we might be working and we have to balance. So open to both of you, obviously, that what do you feel were the challenges that you faced which are unique to SS preparation, and you want to, let's say someone is there in the first year of MD Pediatrics or second year of MD Pediatrics, so they should be prepared for those challenges when they are preparing for NEET SS and INISS.
So one thing is, when you're preparing for MD, you know that you want to do MD. You're very 100% sure that you want it, and you'll give whatever possible. You're giving all your time. You're giving probably 10-12 hours there for preparing for MD. But that is one thing. When it comes to SS, I feel like you have a degree. You feel like some people who are very sure that they want DM in a particular branch, they can go straight ahead. And someone who is a bit doubtful, they feel like they want to work. And because you have a degree and you feel like working or earning, depending on the financial status of your family. And there is one thing where parents are feeling like you're already 26 or 27 and and you still want to study for another 3 years. And when they tell like that, maybe you feel like, should I start working, and then simultaneously should I start studying? And that capacity of sitting for 10 hours is what I felt when I was 21, 22, when I was preparing for MD, I had that capacity to sit for longer hours. Maybe I don't know for what reason, maybe the distractions of the gadgets which were more.
This is the age, I feel.
Yeah.
We all get old.
I could not sit for 10 hours. Then first 2 to 3 weeks when I just finished MD, when I was preparing, I thought I was like studying. Then I thought maybe I'll start working. Maybe it's not working out. Even my mind is not so focused like how I was in MD. And I'm having doubts, what if this branch is better than this? So that doubt was there. In my situation, I was not 100% sure like what is my particular branch. Because just after MD, I gave for cardiology. Then people started telling the pros and cons related to it. And then I also had a shift of mind. Maybe I don't need this. Then I had to figure out a particular branch, thinking other consequences, like whether I want to do the ICU, whether I want to do night duties, whether I want to do long shifts. All that also matters when you are settling down, the stage of settling down, this as they tell. So all these things also matter. So in MD, when we were preparing, we could sit for longer hours and we were very sure we had to take, like you have to take. But here there is again doubt and there is the family pressure as well. So I thought I'll work for probably 8 hours a day, and the evenings I can spend studying. And that was well suited for me, because that working also created an edge interest.
You want to study, interest to study.
To see, because just studying, I felt like I'm not seeing patients, and I was to feel like I'm already an MD. What if I forget
Seeing
things,
what patients.
yeah, seeing patients after, if I take a break for
You
1
feel
year.
guilt either way.
Yeah.
If you study all time or if you work all time, either way we feel
Feel
guilt.
guilt. If you're working all the time, maybe you feel like you're not studying enough, like others who have taken a break. And if you're just sitting, you feel like maybe I'm forgetting my subject. I have an MD, I'm not practicing. And what if I forget general, and if I take a particular subject, I know only that, and what if I don't know general? All that fear is there. But somehow when you make a mind that you want it, then when I got the clarity, then I dedicated my time, even though I was working. So I used to finish my work as soon as possible, and then I dedicate.
Yeah, for me also similar, same thing. I wanted to work and study, but the thing is that I had a kid also, so I had to manage there. If I work and study and also manage kid, then I don't think I would have like cleared. So I had to make sure that I studied like 3 hours a day. I fixed that much only I can put in. So that 3 hours per day at work or at home I had to spend. So I did only part time because there was no one to take care of my kid. My mom had to she was still working, my parents were still working, my husband also was working. I thought I'll do a full time job of being a mom and my part time should be studying. I felt guilty because I was not earning much. This time I'm taking my specialty, whatever this attempt I have to take. Whatever I get I will take. But working and studying always has a extra edge because you see the cases. Nothing beats like seeing patients and studying. I think even questions come more of clinical.
Clinical, no,
Yeah,
coming much
more clinical. So
rather
when
than
you're,
one-liners.
so I felt since I've taken 3 NEET SS, I felt when I finished my MD and took in 2022, I was working full time. I had seen night shift the day before I went for exam. But I could answer. I think my rank was like around 200. My rank was 200. I didn't study much, but I felt, okay, whatever I've seen during my postgrad had come as a question. They were all case scenarios. If I put more of academic effort, just little more theory here and there, maybe I can clear. That's what I felt in my first attempt. Second attempt, again, I was pregnant, I was working. I didn't study much. I just wanted to give just to know how the questions have changed. So again, I felt the same thing. If I put some effort, I can clear. But then I have to sit and put that effort definitely. But more of clinical. So, but this third time when I wrote, I was not touching with my clinical. So I felt very, very difficult. I felt it more difficult than the last 2 years because first 2 years I had the benefit of having seen the patients. This time I lacked that and I felt really anxious before the exam because I was not so confident while taking the exam. Even though we study so much theory, it is the clinical. They ask, the options are all so closely similar that when you see a patient, you will not forget that. But now I have to remember all 3 years back what the patient I saw, this was like this. So I felt that part was difficult. So I felt working and studying is always better.
I think we can all agree that DM preparation is unique in the aspect that either you'll be working or as a professional or as a parent.
Yeah.
Right? Because you will either have a kid or you will be working and then giving the exam. I gave my exam 10 days after my engagement. So
Yeah.
my engagement was on 14th of April, I remember. So half the mind was essentially occupied by that only, right? But yes, you will always have these challenges. When you're preparing for MD, you can essentially stop life, I would say. Other aspects of life. There's only one life, which is the preparation. Studying, eat, study, give exam. That is what your life is. But when you're preparing for DM, life is happening all around you. Be it your personal relationships, be it work, be it financial constraints in some cases, be it kid in some cases and like that. That's always going to happen. But I think she very rightly pointed out that you did not give exam just after your finishing of your MD. Join work. Don't sit home. Join work. You will not have financial constraints because you have joined work. You will make money. You will have some money in the bank that will give you some financial independence. Also, it will give you confidence. Also, you'll keep seeing patients. Also, and then give 3-4 hours on a daily basis. And I think that would be. Anyways, you don't feel guilty that you're not able to study. Even the toppers were not able to study for 10 hours. It's a fact of life that at 26, 27, 28 years of age, you will not be able to study for 10 hours. So even if you're able to give just 3-4 hours on a daily basis, you should be able to crack through the exam. And the working will also going to help you out. Any particular challenge you faced?
No, one thing I wanted to touch upon, which Shobia did a little bit, was when you take the decision at your MD counseling, that whether to take medicine or peds, sometimes it's not a choice, sometimes it is. So there we do have this, kind of opinion or perspective that pediatrics is an end branch. But as we saw in Shobia's case, that changed later. And Shobia did touch upon it a little bit why, but I kind of want to dwell upon a little bit more, because I've seen a lot that even in my case, to certain extent I did think, but that pediatrics is an end branch. Later came to realize that has a lot of caveats. Yes, true it is, but it has a lot of caveats. So at the time of your MD counseling, as well as later at the end of MD, when you did take the decision of you giving DM, what was the thought process like? Did you think that you evolved as with regard to this particular thought process, that it's not an end branch, or is it? And how did you come to this decision ki okay, it is required?
So one thing was the exposure, because I studied in a central institute. Most of my teachers had DM, and I felt like they have strong knowledge when it comes to a particular field. They're confident, and they're representing that branch in the national or international conferences. They're doing good research. So one thing is I got inspired by them. Then when I came back to a metropolitan city like Bangalore, I understood that if you want to have an edge over others, or if you want to have a name, so just MD Pediatrics won't be helpful because of the place. Maybe it is okay for you from where you come from. It is not the same for everyone. But if you are from a metropolitan city, I think you should definitely need an extra degree, need a DNB or DM, to have an edge over the others. So these were my inspirations.
Did you choose pediatrics as an end branch and then later realize that you will actually get an edge by doing DM? Or was it that you already had thought that you will do DM even if you are doing pediatrics?
No, I had not thought I'll do DM. Maybe because when I'd seen few pediatricians before, they had done fellowships and they had good names. So maybe in my mind, I do pediatrics and then probably do a fellowship. That is what was the mindset I had when I joined MD. So I was not very sure of what is the status of super specialty when it comes to pediatrics. But I had decided pediatrics as a branch. So I did not have any confusion whether that. I did not take it as an end branch because I took it because I liked it. So I was thinking later, let me develop it however I want. But I'm sure of pediatrics. I was not sure of medicine because when I was doing medicine, I found it very hectic. In a state college like in BMCRA, the patient input was too much, and I just felt like even the patient input is too much because the residents are also there, but not everyone could be managed as well as pediatric cases were managed. And the prognosis I saw when compared to medicine and pediatric, prognosis in pediatric patients or pediatric resuscitation, anything was much better. And it was a manageable caseload. So that was my points when I considered taking pediatrics or not medicine. Then I thought, let me decide later on, just let me finish MD and then decide what it needed. So I did not have confusion whether the end branch was not the one which lured me into taking pediatrics.
Myself, I felt, no, I was decided it was an end branch for me. For me, I decided maybe people wanted to do. I thought, no, I don't want. 3 years of study is enough. But I decided, like she said, I also wanted to take pediatrics because I like pediatrics. But end branch was an additional benefit I thought I got with it. Take it because 3 years after that, I just want to have a chill life. After that, I will go abroad. I was like planning lots of things. None of it happened. But I thought like after 3 years, I'll work somewhere. General peds, I was more interested. That much I knew.
I'm surprised, like she's talking about Bangalore, which I obviously agree, Bangalore metros. But even in Tanjore, you found maybe a pediatrician would do well, but if you are a neonatologist, you would do amazing. Right? So there's that kind of advantage if you go to those tier 2 or tier 3 places. In metros, it's almost an essential.
If I talk about myself also, for example, when I kind of thought of pediatrics as an end branch when I was deciding between medicine and pediatrics. Having said that, I always wanted to do hematology oncology from my 3rd year of MBBS. So I thought that if I do pediatrics, I can go into hematology oncology, and just in case I don't, I'm tired of studying, and that does happen during residency. You will have those phases where like this is it, nothing more, can't do this all over again. So I felt that's an advantage of being a pediatrician, definitely an advantage of being a pediatrician. And the reason I ended up doing DM also, although I did it in my choice only, pediatric, hematology, oncology only, what my mind went through, and you can also consider it this way, that when you do a DM, that will always count as 3 years of experience. People tend to forget that. It will always count as 3 years of academic experience. So if you are thinking of, being just pediatrics, or maybe going to a government sector as a pediatrics professor as an AP, and you need 3 years of SRship experience, it might be better suited that you might as well do a DM in some branch, because that will also be counted as SRship experience. And then you actually become eligible for two things. You will always be eligible for becoming a assistant professor or a faculty as far as pediatrics is concerned, and you'll also become eligible for that particular subspecialization. For example, in your case, or in your both the cases, for example, like recently only there have been a lot of vacancies in Delhi, not here obviously. Like let's say there are 10 vacancies of pediatrics, hypothetical example. There are also 2 vacancies of neonatology and another 3 of maybe pediatric neurology. So you're essentially broadening your scope from an employment perspective also in a government field. And that is one advantage, that in anyways you are going to do a little bit of SRship to gain that hands-on experience and a little bit of confidence, let's put it that way. Might as well get a degree and improve your both
Actually,
employment.
it was also one of the points I forgot to tell when I was considering pediatrics. I thought when it comes to medicine super specialties, there are already many. When it comes to gastro or anything, you can, especially in Bangalore, I could see everyone. Like when my dad is a doctor, so I could see his friends are already super specialists or doing something. Pediatrics, I felt not many are there.
Not many are
so
there.
probably if you do, or if you become specialist, probably you'll have a better name, or it is easy for you to
It's a good
establish,
niche, yeah, you have a niche,
establish a
yeah.
name probably earlier compared to if you have done the same branch in medicine. That was also there in the back of my mind. I was not very sure whether it is there, but I had considered this point when I was taking pediatrics.
Like neurologists you would find a lot.
Yeah, he
but
was
not a
telling
pediatric.
already,
Not a
even
pediatric
in Bangalore,
neurologist.
Bangalore surgeons, he was telling, one of his friends was practicing for a long time, currently feels like he's going out of patient because there's just so many, he was a gastrosurgeon or something, gastroenterologist.
Even for well-established pediatric specialties, for example, like
Neurology.
even neuro, I will say is still a good established right now, but neonatology and pico. One very big advantage is that the adult subspecialties never want to
Can't enter.
Like they will. I can't do this. They will immediately become like that. They will never touch a 28 weeker 800 grammer kid. And even the pediatricians, like you said, the pediatricians there might be managing them well and they might have the expertise. But there is obviously a different, there is a different edge when you actually do it in a structured learning manner from an institute, which is
3 years.
for 3 years, and the kind of knowledge and expertise that you gain definitely is much more beneficial.
When you're doing your DM prep, obviously there's this thing that you have a lot of extracurricular responsibilities, but also with respect to the syllabus itself. Like as I said, it's not just the vastness. Maybe if we talk about MD entrance, it is 19 subjects, etc., etc. But when we talk about pediatrics SS, we're talking Nelson, which is a proper 1,000-page, 3,000-page book, and that too so dense. So, like, how did that challenge come? Like, with respect to the preparation, zeroing in on or concising your material, like.
In my MD days, I had not read Nelson as much as I should have, because one is work was hectic in PG. I did not have time to read the whole Nelson. Maybe I just pointed out necessary topics which are needed for exam, and I read in the last few months itself. So when I came if I wanted to prepare for NEET, I knew I had to study Nelson. One thing I did is, because I saw videos and MCQs, I pointed out I thought if I just start reading Nelson at this stage, I will never finish it. I will never be able to finish it. So first let me watch videos and questions, then I'll get a point what are the areas they're asking, what are the tables they're focusing, and then I went through it. Basic I had read the main topics or the main final exams that I had read from Nelson. But the new points like this infectious disease or a particular topic of general pediatrics where you don't usually study from Nelson, you study from your OP guy. So certain those things I first read the videos and then I went through it.
Nelson I read during my postgrad, but only during seeing cases and for exams, final exams. So immediately when I took that NEET SS exam, I felt the topics where they concentrate is similar to the topics we get in exam. The topics remain the same. The question framework may be different, but the topics remain the same. So they repeat again. The second time when I wrote, again the same thing. They repeat from those same topics again and again. What I felt was preparing for NEET SS in comparison with NEET PG was easier. Meaning the effort you have to put in one subject more clinical questions, and you know from where the questions come. It is from Nelson, and you also know from which topics it is going to come repeatedly. So I felt compared to NEET PG,
You found it to be more predictable. I
predictable. Yeah, I felt predictable. Probably NEET SS, not from in ESS is different story, because you have to that speciality you should be very strong,
strong
very
in it.
strong. But NEET SS is like everything all around from Nelson. They pick from every page a question. It's like that.
And I think those topics are the similar topics
Yeah.
that you will have to study to pass your MD exit.
Yeah, yeah.
So you are anyway studying Nelson to pass your MD exit. If you go a little more in depth and have a good command and maybe revise it towards the end, you would be able to crack NEET, because it's like you said, it's a little more predictable exam
Yeah.
as compared to the book, the topics, so it becomes more predictable.
Another reason I feel, just post your MD, as you yourself got a great rank of 200, post MD students do tend to get good ranks.
Thanks. Yeah, yeah.
Even if like you study extra after maybe 6 months or so, you might not get as good a rank as you get just post MD,
Yeah.
because you're pretty good with your clinicals as well as your main final exam questions, which are
What was the MCQ strategy as far as NEET SS is concerned, considering the last exam that you both gave was a theory exam? It was not an MCQ based exam, and the last MCQ based exam you had given was 3 years, 4 years ago. What was your MCQ strategy? How many MCQs you thought you will do on a daily basis or in a weekly basis or anything, and what topics will you focus upon? And if you can a little bit elaborate, how was did you find the DocTutorials QBank helpful, or what are the things that you liked, disliked, and so on and so forth?
So I think the first time when you're reading, I think you have to make a timetable for particular subjects. And then if you're studying hematong probably, so you have to study those subjects and you have to study the question bank from questions from the question bank regarding that subject. So you know where they are asking questions and what are the important points. Okay, so that is the first preparation. You have to solve MCQs according to that, and probably when you have time, you can give 1 or 2 granted just to see how you can be able to solve. So once you're done with the revision, I think you'll have to do a daily set of MCQs covering all the subjects, like probably 50 would be sufficient, or because I was using those mini test and elite test. So in between I was solving and I'm revising another subject and I'm solving the elite test. That was helpful actually. I'm trying to recall what I studied like probably 2 weeks back. So actually in the last 1 or 2 months, you should be daily doing MCQs. Whichever number is sufficient according to your schedule, either 50 or the more the better.
The more the better.
And you have to give your grand test as frequent as possible whenever you're coming to the end. And probably in the last 3 days, you just focus on studying. I think the questions and grand test, I think, makes a lot of difference, because everyone is studying the same source or this thing, but whoever has practiced more questions, whoever has faced more questions, has better edge over those who have not done yet. So I think the last 1 month is very crucial for me, because that is last 10 days I took break, and then I kept on
Solving a lot of
revising and
MCQs.
solving a lot of MCQs.
For me also, I also solved a lot of MCQs. I like I said, I had time only for solving questions. So every day 3 hours. So I solved like 50 to 60, probably 100 even initially. So I kept solving questions and I took a lot of grand tests. And I think DocTutorials grand test is like they put like every 1 week or so. That too from Jan, I think many tests were upcoming.
tests.
So mini tests
Tests were
and
there always. Yeah.
so I felt it very useful because I didn't know where I stood. The thing was, like I said, I took 2 NEET tests already. I knew back then what my rank was. Right now, I knew the competition is more. People come out like this year, many people, 2 batches are writing. So I felt the competition is more. I didn't know where I stood. So all I knew was like I had to get like 120 questions right. That much I knew. For 150, a top ranker should get like at least 120 right. Then I'll be in the safe zone to get my speciality. So 120 questions. So I had a fixed target. Like, so 150 questions. Initially, I wanted to get 110 questions right. Only then 120. So I was like, no matter what rank I get, I always took GTs. I took a lot of GTs. I was not scared only, because we get anxious when we see that rank, like we get like only 100 questions right. Then okay, it's the same 100 questions. Always I'm getting only 100 questions. But then I thought, okay, doesn't care. Who cares about it? 120 questions daily. Like daily I'll do 100 questions or something. I solve modules, and whenever there is a GT or whatever test is coming live, better to take it live. So when we take it live, we get an idea where we stand. and we make silly mistakes. So I think when we correct the silly mistakes, that by itself gives like another 5 to 10 questions, which
150
is
questions, somewhere 2 or 3 questions you would have not read properly.
yeah. It will be it will be at the topic that you think it is right, but then the twist is there. That's always there. NEET gives the twist. We think this is the sure right answer, but then the twist. So that practice comes only with GT and QBanks. No matter how much we read, it is only the QBank, yeah. So I didn't like sit and study like chapter wise. I was like, I'm solving 100 questions today, this topic. So I solved the questions and then I go read the topic. So I felt that.
Very important. Like I think a lot of people, this is a very common mistake which a lot of people do irrespective of exam, that they just keep on studying and don't end up practicing MCQs. I think both of them have given a decent enough a number that at least towards the last 3-4 months before the exam, get the DocQbank and try solving at least 50 to 100 MCQs on a daily basis. Don't be scared of GTs. Give that GT once in a week, and sure, you might be just getting 100 questions correct in that 150 question. Doesn't matter. You'll over a period of 2-3 weeks, you will realize what the silly mistakes that you are doing. Like, you might be knowing the topic, but you would have read it incorrectly. The question was be asking which is an incorrect statement, you must have read it, which is the correct statement. You must have missed out a not in the question, or you must have missed out something in the question, some silly mistakes. And obviously, when you do those silly mistakes prior to the exams, 2-3 times, and you correct them, that's why when on the actual exams, you won't make those mistakes. It's important to make those mistakes prior to the exams, and you won't unless you actually solve the MCQs. So, 3 months, 4 months prior to the exam, get a QBank, start solving at least 50 to 100 MCQs, and don't be scared of GTs. I think that's the mantra that everyone can take from this, right?
I think another thing Shobia specifically said was targeting that correct answer number. Like, because sometimes what happens is some exam people number might go a very high number and your rank might get pushed back. Someday, some exam people might not give it. Your rank would be, a very good rank, disproportionately good rank. But if you're targeting that number, there's 2 things that happens. You have a very accurate assessment of where you stand, how your preparation is going, and it gives you that self-sufficiency. Okay, I'm at 110 now, I'll go to 120. So that kind of self-sufficiency comes in. And especially at Doc, we try to keep the difficulty level of the exams standard, right? It's not like one exam you get 100 and it's actually good, and the other exam it's not like that. Almost all exams are the same standard. So you can actually aim to get a specific number of answer, right? And she did it much better, looking at the previous rankers and their cutoffs, and then deciding her own cutoff and getting.
So another thing I want to say, that if you feel that you don't have time to study theory, like you did not have, for example, then even then just, you are working, you are a pediatrician, nobody's going to take away that MD degree from you. You have that basal knowledge. Solve 50 MCQs on a daily basis. Even that will, you might.
Retrospective study.
Yeah, in the retrospective method of study in the last 2-3 months, even if you don't have that much time, daily giving those 3-4 hours, 50 MCQs on a daily basis, 1 hour of MCQs, 1 hour of study, a little bit of revision. Even then, there is a good chance you might end up getting a good rank. Like, what I really want to say to everyone giving, like, don't be guilty that you're not able to study 10 hours a day.
Yeah.
Especially in this age, even rank 1 was not, let's be honest, would not have been studying, or
very few would be actually just sitting and studying at this stage.
Like that. Everyone is studying for 3 to 4 or maybe 5 hours or 6 hours on the higher side, maybe on a day, and that too, I think just 1 week or 10 days prior to the exam probably. So don't be guilty, but ensure that you utilize those 3 hours that you study properly, be it in the form of MCQ practice or be it in the form of targeted topic revisions, which are important as far as NEET SS is concerned, that you already knew that these are the topics they are going to ask again. So don't waste your time in those topics which are low yield, revising those which are low yield, like that.
I feel like when you're solving questions, especially in NEET, certain questions are taken from tables of Nelson. So when you just read it, it doesn't register in your brain. Only if you solve that question, it goes into your head, like certain points, like this time the breathing pattern, or the nasal cannula flow and all that. So when you're reading, you feel like, I know this, I've read it.
But when you make a mistake,
but when
that's when you
options are very similar, it's 0.5 and 0.6. So if you already solved that question and you've made mistake prior, then you are very vigilant and you know what to mark. Especially tables, other than if you not solve questions regarding the table, it's very difficult to, like, you feel like when you're reading, I know this, but then you tend to make mistakes.
if I have to ask you this question, like in doc, there are multiple ways to test yourself. The QBank. So there's the proper QBank, there is the elite test, there are the mini test, the grand test. You have to choose one. Which was the best? Which will you choose?
Grand test.
Grand test.
Grand test.
Grand test. I think that's.
I think that's lesson to everybody. Grand test is one where people think, I'll be all prepared and then give. Obviously, you have cleared your MD and you know best that is not the way to go. Give your GTs, correct yourself, get what you're, understand what you're getting wrong and work upon that. That's a basic thing that, all of us know, and just remind yourself, because it's been 3 years since you did that. So again, kind of train yourself back to get into that mold of giving grand tests. Before we sign off, just a little bit of, advice, because I know that a lot of NEET SS Pediatrics, especially, we have very little advice, guidance for NEET SS Pediatrics on the web. So what would you advise your juniors from a, especially from your final year pediatrics or post MD perspective? That is one area where.
So now I think the trend to prescribing this apps, the super specialty apps, is increased. So when I was in first year, none of my batchmates were using, but when I see my juniors in second year, they have it. So probably I did not take it when I was in MD, but a few of my batchmates were prescribed. I mean, they were subscribed to this super specialty platforms from the MD, especially in MD exams. I think they did well compared to me. I felt like that because maybe I don't, because the work and everything also. Because they were studying more seriously, or because they had a source of preparation and they're studying, their MD preparation was slightly better than the exit exam was slightly better than me, and the awareness has increased. Our juniors are probably taking from second year and they are already deciding. So the competition is coming up. So I think if you want to have an edge over the others, I think you start early, and starting early and being more focused. The earlier the better when it comes to preparations like this, if you're starting earlier and this thing. So enough platforms are there. If you want to do DM, then you have to start early. That is the one advice I would give. And I think nowadays you have for the MD residency also, they have videos,
we have a doctor
probably that will understand in case taking and understanding the management better also. So because in doing MD, even though college teachers are willing to teach, you are not always in the position to listen to classes because you're overworked, you're tired.
Exactly.
And probably, but when you can go back and listen to something probably at your own comfort.
I think it's more of a passive learning rather than this is what I was discussing with Vishnu yesterday itself. Actually, what we said that it's fully possible that you had probably a 8 to 8 schedule. You went to work at 7 o'clock or 8 o'clock in the morning, and you came back at 8 o'clock in the night. Someone can say you have 4 hours, pick up Nelson, read up the case that you saw, but you're not in that state of mind to read Nelson, right? Now, the state of mind to read Nelson will come 3 months before the exam, when the duties would have also been relaxed. People know that you're going to give the exit exam. So, but when you're in your second year, then what do? Do you just switch on Netflix, go to sleep? No, you don't do that. Maybe you can just watch these videos, or maybe just solve a QBank for that matter. It won't seem that taxing as much as picking up a book and reading it from the first line to the last line.
That to reading Nelson, which is quite extensive.
Extensive, exactly. Yeah. So sure. We really don't want to say that don't read Nelson. A lot of people might get this bad impression that this is a substitute for Nelson. It's not a substitute. I really want to emphasize that. You have to, when the exit exam is going to come for those 3-4 months, you have to read Nelson. No doubt about that. But sure, in the second year, when you don't have that much time, or more than time, you don't have the bandwidth to read a textbook, the intensity that it desires. Maybe just watching these videos will keep you in the flow, and it will keep you more focused, like you said, and maybe help you get a better exit exam marks. And
it's easier to understand also probably than from textbook and from watching and someone telling you, teaching you is obviously easier than you reading yourself and then understanding.
It saves a lot of time. If I sit and read it in Nelson, it will take definitely 2.5-3 hours. But the same thing can be conveyed in half an hour with much better references. I think having if I had access to all this during my residency, I would have definitely gone for it. If I had the idea back then, or some guidance to tell me that, then I would have definitely gone for it, because it saves a lot of time. Sitting and starting again from square one is kind of difficult.
Yeah, definitely.
Even people talk about concepts from textbook. Yes, concepts are best made from textbooks. First, but for example, if you want to read HLH, right, you will have to spend at least half an hour to 45 minutes to understand
What
the
HLH?
crux of HLH from a Nelson or any textbook. A video or somebody teaching you, you might at least understand something with a much lesser energy requirement.
Energy requirement.
You might just see for 15 minutes, at least you'll get some concept. If you open Nelson, you have to give that 45 minutes. Obviously, it'll work better, yes, but you may not have that energy always, right? So
Even
that's
if you watch video, reading Nelson also becomes easier.
Easier,
You
yeah.
already know what you're
going to
what you'll be
read.
reading from the paragraph. You're just picking up the points from the textbook, or else you're
Use
searching for it.
Use it as a tool for a better Nelson retention.
Yeah.
But I would still advise that what I feel is a lot of people take a wrong message out of this, that you can skip Nelson. That should not happen. Use it as a tool so that the Nelson reading becomes easier. It becomes more retentive in nature. But don't take the wrong message out of it, that we will do just the videos and we won't read Nelson, because you will be at because then they will ask questions from those tables, they will ask questions from those lines which you have not read probably, right? So that would be counterproductive or counter to your preparations. So yeah.
I think the recall videos are much better in DocTutorials.
Okay. Thank you.
The QBank especially, because we had a lot of questions in this NEET SS which had come like verbatim from the same question.
Especially
I think
in the grant test, I feel.
Yeah, GT.
Because
yeah.
I've given grant
because
test,
the
similar
last
questions
GT I
were
took
coming
a few
in the
questions were
final
the
exam.
exact same question. So I felt, because I made mistake in the grant test, I knew, oh thank goodness this question came, because those 2-3 questions change our rank, right? Definitely.
Especially
Only
the
3-4
last two
questions.
grant tests were very good. I
Yeah.
felt that
I
made
felt the
a
GT.
difference.
The
And
recall
I think
questions.
in the last grant test we also had a video discussion of
Yeah,
explaining
yeah.
everything.
Yeah.
I think did you guys like that
Yeah,
video
yeah,
discussion?
Yeah.
Especially for some questions which are difficult. Like I saw him discuss some critical care questions which were a bit ventilation and other things. Where he was telling where you can go wrong, but you should not make this mistake like that. So that was
I
something.
felt the recall session was very useful.
Something which I always say, that PYQ se hi aata hai paper. People
repeat
question
topics
the
as we
question,
have
like
been
she's
discussing.
always saying the same question and the same topics are coming. So do watch the recall videos. I would say one thing: the INISS recalls that we have discussed, they're not available at other platforms.
That's why we don't
Yeah.
focus and we don't talk about it so much because they'll get copied.
But the INISS recalls may be a little different, but the INISS recalls are not available at other platforms. And the reason we also have the access is because we did our post-graduation from those institutes, so our seniors have at least told us about those recalls and they have that. So that's one advantage you can take from us doing our, our MDs from those institutes. But yes, definitely do the recall videos. They are very high yield.
Yeah.
They're very high yield and grant test. All right. Thank you. Thanks a lot.
Thank you so much.
Thank you so
Thank
much.
you.